transitioning to our next session, we have Carolyn Tredinnick of Colorado State University and Jordan Parmenter of University of Northern Colorado, who will share about how to prepare and what to expect in grad school. And what's great is that Jordan is actually a current graduate student, sorry. So it'll be great to get her firsthand experience. So take it away. Thank you.
Awesome. We'll just start introducing ourselves briefly. So my name's Jordan Parmenter. I use she, her pronouns. Like I was saying, I am a current graduate student at University of Northern Colorado in Greeley. I'm currently getting my master's in clinical mental health counseling. I'm a graduate assistant at UNC's Center for Career Readiness, but I'm also have been doing my internship at Colorado State University in their counseling services, both in general services and their day program, which is a substance abuse program for college students. So I'm excited to talk with you all.
Thanks, Jordan. I'm Carolyn Tredinnick. I am an LCSW. I currently am employed at Colorado State University in the School of Social Work as a field education coordinator, which means that I am currently working with our graduate students around applying for and getting their internships, which are a requirement of the program as they enter the field of typically behavioral health as social work students. So we work with a wide variety of students in a lot of different ways. And so I'm excited to partner today with Jordan and kind of go over what to expect as you're thinking about graduate school. And then we'll answer any questions that you all have.
Yeah, awesome. And I see some questions popping up already. Should we address those first, or should we just talk a little bit about our experience? Carolyn, what is your preference?
Why don't we go through just some details first about the process, and then we'll answer as many questions as we can towards the end.
For sure. Okay, cool. So a little bit about my experience with graduate school. In my undergrad, I majored in psychology with a minor in social work, actually. And what I wanted to pursue counseling, and I wasn't quite sure how I was going to do that. So luckily I had built relationships with my professors in the psychology department who were really my mentors and helped me start the research process early on of where I wanted to go. So it was really helpful for me to have the end goal in mind, knowing that I wanted to be a counselor and then be able to backtrack and see how I could get there. And a lot of it was researching different universities and seeing what counseling programs are out there, but also knowing that, how do I say this? I really made sure that if I was going to graduate school, I was going to graduate school for a reason, because grad school is no joke sometimes. It's a lot of money and time and effort that you're putting in. So I wanted to make sure that I was choosing the program that was best for me. So a lot of that was talking to my professors, talking to my family and my friends. So I think for me in graduate school, the support system was probably the most important for me when deciding that factor.
Sure. So I took a little bit of a different route. My undergraduate degree is in sociology and history. I always knew I wanted to work with people and help people, but I wasn't quite sure what that looked like as an undergrad student when I picked my major. So I had some inklings during undergrad that maybe I wasn't on the right path, but I figured I'd get the degree, figure it out later. So I worked in the field for a while in emergency services, and then realized I wanted to do more. So I explored a lot of different career paths. I thought about being a teacher and talked to some folks about, getting a teaching degree. And then they asked me questions about why I would want to do that. And none of my answers were about actually teaching. They were more about engaging with youth, being a support system, things of that nature. So for me, I ended up in a social work program because of that. Looking back, there's things I would have done differently because I honestly didn't know what I was getting myself into. So some of the things that I would have considered in a different process were to look at the jobs that I would have been interested in and what were those degree requirements. Would an LPC and a counseling background have helped me differently than being a social worker? So I think looking at, if you're considering graduate school, what's your end goal, as Jordan said, and what degree fits best with what you think you'll be interested in. Also, talking with other people in the field. I honestly didn't really know any social workers until I joined a graduate program. I had the misconception that most of them worked in child protection, and it's a much larger field, especially at the graduate level. So talking with others who are in the profession about maybe what they would have done differently or what they would suggest. So Jordan had some great experiences where she had some mentors and people that talked with her during her undergrad about it. But even if you've left school or aren't on that path yet, I think finding those people in the community that do the type of work that you would be interested in doing and connecting with them can be really helpful, and then giving you that direction as to what program or what graduate school to look at. And then I also know in the last session, they talked a lot about licensure. So keeping that in the back of your mind, that a lot of graduate behavioral health degrees have a licensure component, and making sure whatever program you're in aligns with the licensure that you're anticipating.
Yeah, and one thing that you're making me think of, Carolyn, that I should have added. So talking to others in that field is really helpful, and in the career world, we call that doing an informational interview. So when I first got into my program, I did an informational interview with someone who was an LPC, kind of just to get her experience, what it was like to be a counselor, how the licensing process was, because it can be a little confusing at times. So, and that's totally welcome. Like, folks love to talk about what they're doing, help give advice for others, help support. So don't feel afraid to go out and talk. Like, I know I'm not licensed, I'm not graduated yet, but like, I'm more than happy to support you all in any way that I can, because I know that process can feel overwhelming at first, but setting up those informational interviews are so beneficial. And then it also gives you a way to not only connect, but also potentially network. So I think informational interviews can be really helpful as well.
Sure. I think something else to consider is, as you're approaching just the idea of graduate school, what's reasonable in your life? So what type of program, location, cost, your personal and professional supports, and the type of learning environment that fits best. There's a lot of different opportunities out there from a wide variety of universities. Some are all online, some are in person, some have a hybrid component, some are full-time, some are part-time. So those are all just things to consider as you're looking at graduate school.
Yeah, for sure. Just because I'm noticing these questions popping up, is it okay if we transition to answering these questions? Okay.
I think that would be helpful to give the difference between counseling and social work.
Yeah, so I can speak for what I've been doing in my counseling program, because I'm not too sure what that difference would be either. So for example, in my counseling program specifically, we focus a lot on meeting with clients, building those relationships, things like that. So with my program specifically, it's the track I'm on, a clinical track. It's a 2.5, 3-year, usually that around time program. So what you start off with is like the beginning of your program is filled with courses like theories of counseling, substance abuse counseling, diagnosis and treatment, your foundational classes. And once you have those, you move on to your practicums and your externships. So at UNC specifically, your first practicum is within UNC. We have our own psychological services clinic for us prac students specifically, and we're meeting with college students, but we also meet with the community, and that's like your first experience. And you usually have 1 or 2 clients on your caseload, and you have the team there to support you. We have like the one-way mirror, we have videotape, we have everything. We have people watching you, like your supervisor and a couple other prac mates watching you. Once you're done with your practicum 1, you move into your practicum 2 and your internship, and that's having an internship outside of university. So for example, I spent both my practicum and my internship at Colorado State University, but we also have so many interns that go to North Range. We have so many students at North Range Behavioral Health. We have Heart-Centered, Devereaux. Like you have I think we have like maybe 50 sites that are pre-approved, but that doesn't mean you can't introduce new sites that our students are going to. So that's kind of how our program looks with counseling specifically. And within that, you can like major or specify in clinical mental health counseling, which I am in, and that's kind of the more general track. But mainly I'd be meeting with individuals. We have a school counseling track, which is just as it sounds in the school system. And then we also have a marriage, family, and couples track whose program looks a little bit different. And obviously their focus is going to be on family and couples.
Sure. So for social work, there's a clinical track. There's a lot of things you can do, but generally speaking, social work looks at people in the environment, and it's a broader focus than a counseling track. So there are multiple MSW programs throughout the state of Colorado. Each one's a little bit different in their focus. CSU specifically, we refer to it as an advanced generalist practice. So what that means is our students get coursework and then also are expected to have experiences within their internships around individuals, families, groups, communities, research, and policy. So you're getting a wide breadth of everything from working at the micro level with individuals up to that macro and policy level. So legislative changes that are coming through, social workers will advocate for that. There's community pieces of advocacy around access to a wide variety of things. So many students still intend to do one-on-one and very clinical work, and there's coursework throughout the program that will support you in that. Metro State is very similar in that. DU definitely has a more clinical focus as far as their program, but there's different tracks. So there's school social work as part of this. There's medical social work. There is working within community mental health. And then throughout your social work program, whichever one you choose, whether it's Colorado State or any of the different ones across the country, really, all students are required. There's not a practicum. Typically you do two separate internships. One is a foundational internship where you're really gaining skills that maybe you don't have from previous experiences. And then you do a concentration year one. So ultimately you end up with about 900 hours of internship experience prior to graduating, and you must do all of those hours. It's a requirement. Field education is an integral part of a social work degree. So we're hoping that you're using your coursework in your field placements and in your internships so that they're really tied together. So as far as kind of a difference between more of a counseling program and a social work program, from my understanding and my perspective, counseling is definitely, you want to work within kind of a mental health or with individuals, groups, families around those counseling pieces, where social work can also give you some experiences and some knowledge, maybe at that bigger macro level or in different community organizations, and not just mental health or substance abuse.
Yeah, I think that community and policy piece is key, because at my internship, one of my fellow interns, she is in the social work program at CSU. And I think that's the biggest difference for us, where she has that community policy experience. I don't. And where I have the like foundational counseling theories, evidence-based practice, she's also learning in the moment, because I know she can take classes on that. But I think Carolyn's right, like that probably would be the big or the main difference between counseling and social work. Yeah. I saw a question about, can you have a full-time job and go to graduate school? Okay, so my track's a little different. So my first semester in my program, I was actually working at North Range in the wings department, and I did that my first semester, and sounds really intense, but this is what you think you can take on. I was taking 18 credits my first semester, and I was working about 40 hours at North Range. And for me, that was like, okay, it got a little bit much at some points, but like it felt manageable to me. But I knew once I was going to get into my practicums and my internships that I was going to have to go to part-time or save enough money at the beginning so that I can just focus on my internship, because it does end up taking a lot out of you. So your first practicum, second practicum are about like 12 to like about 12 hours, but then your internship ramps up to like 25 hours a week. So I knew that I wanted to have that focus. In your program, you would have to look, but at UNC, we have graduate assistantships. And if you get a hold of one of those, it covers a certain portion of your tuition, and then it gives you about a stipend every month to live off of. So I got that I have at Center for Career Readiness, and I have not let go of that because it's been so helpful. And GAs, they are very understanding that you're a student first. So most GAs at UNC are about 18 to 20 hours a week, but you get, I think it's up to 9 or 10 credits covered. And then what's left is just like some student fees. And then you get that stipend to live off of every month. So if you are looking to apply to graduate school, I would definitely see if your program, I mean, the university in general has any availability for graduate assistantships. Sometimes they only have them for doc students, but there will be programs that also offer them for master's students like UNC.
And then for myself, I worked full-time because taking time off and not having an income was not going to work for me. So there are many programs out there that I think offer either a part-time or, so CSU specifically has it's called a hybrid distance program. Distance just means we have students up and down the Front Range and even from other states within the program. However, it's the same coursework, the same expectations. It's just spread out over a longer period of time. So it's a 3-year program instead of 2. So you're taking the same classes, just at a slower pace as far as number of credits per semester. And that typically all of our students who are in that program are working full-time. So there are other programs out there as well that offer more of a part-time pace. So it may take you an extra year, but then you're typically able to maintain employment at the same time. In addition, there are ways to pay for graduate school. There is financial aid available out there. There are scholarship opportunities. So there are other ways aside from working or doing a graduate assistantship to kind of help with that financial burden that graduate school will bring.
Yeah, and with our program specifically, you have up to 5 years to complete your program. The clinical track that I'm on is like 2.5. I'm doing it in 3 years, and that's totally fine. You take your program as you need. We call ourselves a cohort, but we're not a true cohort model in that we all don't move at the same time. Like you can be part-time one semester, full-time one semester. So you can really take it as you need. And I've really relied on my advisors to help talk me through that too. And that's been a really good support system for me as well.
So Jordan, some of the other questions in there are a little bit about like the pipeline and also applying to graduate school and things around the GPA. So I think we could talk just generally speaking about applications, what to expect, and then some of those pieces that they're going to ask about on the application and how to maybe up your GPA or address things like that.
For sure. So I know most graduate school programs are similar to mine in that you have the initial application process where you're giving your CV, resume, your personal statement, and then like your transcripts, your GPA, things like that. For UNC specifically, you don't need to do your GRE. So I don't have experience with taking the GRE or what that process looks like. But after that, like let's say you're good, you would get an invitation to do an interview. UNC's is like a all-day group interview pretty much, where before COVID, I think they did it online this year, but before COVID, you would be brought in, most of the program faculty would be there to kind of introduce themselves. So you get a feel of, the professors you'd be working with. You would do a group interview where you'd get asked questions, and then you would take a tour of the counseling program specifically and where you would be working. In terms of GPA and GRE and stuff, I am such a bad test taker. It gives me so much anxiety. So I really was stoked that UNC didn't have to do the GRE. And what I think I was most insecure about in that application was when they asked about my clinical experience, because I was like, what? Like I'm an undergrad, like I don't have any clinical experience. And a lot of it was relying on my research assistant and my teaching assistant that I did in my undergrad. So I used that to kind of help bulk me up with not having the GRE, but then also not having like the best GPA. So the personal statement was kind of where I shone a light on like the experience that I had not related to my grades, because I think there's more to us than our grades. Yeah.
So for CSU, and I think a few other social work programs out there as well, there is not an in-person interview component. So it's a lot of paperwork. So I would strongly suggest making sure you know the timelines for applications. Is it a rolling application where they accept students throughout the year, or do they have a deadline? And then planning around that, because everyone will ask you for your transcripts, and every university takes longer about processing and sending out official transcripts. And then making sure you know the requirements around experiences in the field. So CSU will ask you how many human service hours you've done. You need to do at least 400. So that's a time where you can share about volunteer experience. Really, they're looking, have you ever interacted with other humans in a helping way, which can absolutely be volunteer experience, or it can be work experience or an undergraduate internship, things of that nature. There's still that essay, that personal statement about why you would be a good fit. And then typically there is a requirement around a GPA. So full disclosure, my GPA was not fantastic as an undergrad. However, I still got into graduate school. So they didn't count my D in chemistry that I got. They looked at the courses that were more applicable to what I was applying for. So yes, I was required to take science classes in my undergrad. However, I didn't do fantastic in them. I'm glad I'm not a nurse. So looking at that, they will look deeper than just your overall GPA is whatever it is. You know, how did you do in your psychology, or in my case, my sociology classes? That was more indicative of how I would do as a graduate student in social work. So sometimes our students who don't have a really strong GPA come in on an academic plan, just needing to kind of have a little more support and stay on top of things to make sure that you maintain good standing. We also don't require a GRE. I don't know that a lot of programs currently are requiring that, but that's another piece to look at. And if you're not a great test taker, then maybe looking at a program that doesn't require a certain score on a GRE. Also, sometimes there are prerequisites that a school may want that you didn't take in undergrad. So that's an opportunity. I had to take a human development class, and I did it through an online community college. So just knowing those pieces of what they're going to expect in an application, it should be very clearly stated in their application on the school's website, so you know what to expect. But being a completely strong student, I think a lot of programs are looking more globally at who you are as a person, your experience, not just how you did in chemistry and how that affected your GPA.
Yeah, I went to CSU my first couple years of undergrad, and psychology was like Bachelor of Science, and I just saw those science classes like, oh my God. But then I transferred to Metro. That's where I got my degree in as Bachelor of Arts, and I was like, whew, had to take like one human bio class and I'm good, you know? So I get that. And one thing I forgot to mention too with the application process, like Carolyn said, it should be like clearly stated like what you need material wise, but you'll also need like reference letters. So making sure you're doing that ahead of time too, just so you're giving whoever you're asking a good chunk of time to do it, but also to like hold them accountable when that deadline does come, because it can come up quick. So just start to think about like who you could ask for references. All three of mine were from my professors, but one was like a professor I did research with, another was a professor I did teaching with. So just kind of have that in mind, and you know, connect with whoever those folks are to start that process too.
Great. All right. So generally speaking, I think just some things to consider for graduate school, and then we'll get into the other questions that are in the chat, because you guys are asking some really fantastic questions. Just some advice for when you're in graduate school, and Jordan currently is, so she's going to be an expert on that. But I would just say, it's different than an undergrad. So being engaged with your coursework, just at a different level, because A, it's expected of you, and B, you'll get more out of it. And communication is huge with your instructors. They want to support you. So in undergrad, I always felt like I was in these big classes. I didn't really know my professors. I wasn't really going to engage with them. It's different in graduate school. So I would really encourage engagement, time management, and then just your own expectations. I think everyone wants to do so well, so not overly pressuring yourself once you're in graduate school. But Jordan, I don't know what you would add to that, but I'm sure.
Yeah. Yeah, I would totally agree. Grad school was like a different world that I entered, and a lot of it is like they expect you to be on top of your stuff, you know? It's very on you. So like if I think about when I was in my first year in the program, when I was just mainly doing classes, our classes are once a week for 3 hours, you know, and that was it, which I wasn't used to having like Monday, Wednesday, Friday classes or Tuesday, Thursday classes. So it was like once a week for 3 hours. And the content of our classes were mainly focused on like processing what our readings were, or processing whatever it is we needed to do, and having that conversation piece. I think that's kind of different than typical like undergrad like lectures. They're not lectures. They're really times to have conversations and to get that experiential learning, which for me was really beneficial to be able to have that. And I agree with Carolyn of like being communicative with your professors, because they really care about you and they really want you to do well. And one of the best things is that graduate school, your classes are going to be way smaller. So you're able to form those connections with not only like fellow students, but also with the professors. Like I think like before COVID times, I would go to my professor's offices all the time just to talk and catch up and just let them know where I'm at, because they really do care about you. So I think fostering those relationships with the professors, but also the other students is really imperative to help start building that support system, because you're all kind of going through that motion at the same time. And it's nice to know that there's others that understand what you're going through. But I've also loved the freedom that's come with graduate school. Like I feel, it feels weird to say, like I felt like an adult, but like I felt like they treated me as like them, you know. I wasn't like, there wasn't a power dynamic, which I really appreciated. They never made me feel like I was below them or anything, because that conversation, that experiential piece was so there, and they want to know what your thoughts are. They want to know what you're thinking. So that was really key and important for me as well in terms of graduate school. And then like once you start going down the line, like I have in my program, it's less class focused and more internship focused. And we have an internship class from our program that meets every other week for 3 hours. And it's really just to check in about how your site's doing, to make sure you're getting your hours, things like that.
Great. All right, so we have a lot of questions in the chat. I'm also going to put my email address in the chat. Please feel free to reach out to me, because I'm not sure in our remaining couple of minutes we'll get through everything, but I will try and answer a couple of the social work questions as fast as I can. As far as those of you who might be at Front Range doing either a variety of programs there, the pipeline to CSU and maybe graduate school, typically you will need an undergraduate degree of some sort. It does not have to be in social work to then get a master's degree in social work. If you do choose to, say, get your BSW in social work, you can cut a year off of graduate school. If you come from a different background, then it'll be either 2 or 3 years. And then as far as if you're in a nursing program and considering behavioral health in some way, I would just explore, are you more interested in counseling? Are you more interested in a larger perspective of the human experience? I also know that there's psychiatric NPs out there that are specializing with their nursing background, still in that medical piece, but more on psychiatry. So I would, again, just ask questions of those who you're interested in the type of work they're doing.
Yeah, and I missed this one before too, the write a thesis to be a counselor. In our program, no, you just have to do the program requirements of the class and the internship, and then you have to take a test. It's your comprehensive exam at the end, and that determines whether you can graduate or not, a lot as also with your internship hours. So no thesis writing in my master's program. And I also put in there too. I'm more than happy to answer any of the questions further. Yeah.
Sure. Social work also does not require a thesis. You do a research project at the end, and then as you approach licensure, there's a licensure exam instead of a comprehensive exam at the end of the program.
Well, thank you so much, Carolyn and Jordan. What great information. Got the inside scoop. That's wonderful. Thank you so much.